Bismillah Rahman Rahim. Assalamu alaikum. Dear colleagues, before we begin, I want to ask you a simple but uncomfortable question. We spend our lives listening to our patients, but when was the last time someone truly listened to us? As doctors, we carry the weight of suffering, disease, and death every single day. Yet, we are expected to remain unshaken, unbroken, and always available. In today's lecture, I want to break the silence that surrounds our own mental health. This is not just another medical topic. It is about us, the healers who also need healing. Today, let's create a safe space to reflect, to be honest with ourselves, and to realize that caring for our own mental well-being is not weakness. It is strength, it is responsibility, and it is essential for the kind of doctors our patients deserve. Bismillah Rahman Rahim. Imagine a surgeon who can hold a scalpel steady for 6 hours but cannot hold his own life steady after the shift. Imagine the doctor who teaches others how to live but does not know how to ask for help. Today, we speak about the healer who is hurting physician mental health, not as a lecture, but as a call to protect our profession and our patients. I'll start with a story. 28 years old doctor, a brilliant trainee, the top of her class. She worked 24-hour on-call rotations in a public hospital. One night, she led a resuscitation that failed despite everything being done correctly. She went back to the ward, documented the notes, and walked home in a city that never sleeps. Over weeks, she stopped answering family calls, started taking pills to fall asleep, and once, while waiting in clinic, she found herself staring at the needle drawer and thinking, if I disappear, who will miss me? She did not reach for the needle. She reached for a colleague and finally spoke. That conversation changed everything for her. Stories like this, doctor, are not rare. They are signals, loud ones, that we can no longer ignore. The hidden burden on doctors. How big is the problem? What is the latest picture? Let's analyze. Globally, surveys show physician burnout is widespread but may be slowly shifting. Large physician surveys in 2024 reported roughly half of doctors describing burnout symptoms, around 49% in major Medscape reporting. This remains substantially higher than many other professions. Suicide among doctors is a public health tragedy with a worrying pattern. Recent meta-analysis reveal female physicians continue to face a significantly higher risk of suicide compared with the general population. The elevated risk for female remains an urgent concern. In Pakistan, the signal is strong in training pipelines. Multiple local studies report high burnout prevalence among medical students and residents. Many surveys show large proportions, often 40 to 60%, depending on specialty and tool used. Young clinicians and trainees are reporting high emotional exhaustion and distress. Official guidance and national plans now treat clinician well-being as a system priority. WHO guidance and national frameworks in many countries emphasize organizational action, not just individual coping. Do any of these numbers surprise you? Or do they feel like the quiet truth of your word? Please reply in the comment section below. Why are doctors suffering? A layered view. Why doctors stay silent? What are the barriers to seeking help? Let's review these questions and try to answer these. The causes are complex and stacked. The first is workload and staffing gaps. Crowded wards, long rosters, insufficient rest. All these lead to mental burnout. Then the moral injury. Being forced by systems to deliver care that falls short of what clinicians know is optimal. Long working hours. Then administrative burden. Paperwork, documentation, insurance, sehat card, and bureaucracy stealing time for patient care. All these contribute towards mental unrest and mental burnout of doctors. Then stigma and professional risk. Fear that admitting mental health needs will harm one's license, career, or even reputation. Then exposure to trauma, repeated loss, violence, and high stakes decision making without structured debrief. All these leads to mental burnout. Last but not the least, gendered pressure. Women doctors often face additional burdens, discrimination, harassment, and conflicting expectations at home and work. So, all these are the contributing factors towards mental unrest, mental burnout of doctors. How to recognize that someone is suffering from mental burnout? Clinical signs among colleagues and self. Look for these. Look for patterns, not a single moment. Red flags include if you or your colleague have these, definitely he or she needs care for that mental burnout. And these red flags include persistent emotional exhaustion, cynicism and irritability, decline in clinical judgment or increased errors, sleeping problems, appetite change, and even substance use, withdrawal from family, colleagues, and unexplained absences from the work. If you see these, act early. The most effective interventions begin with recognition and a safe conversation. So be careful and keep the threshold for diagnosing mental burnout low. What actually helps? What are the practical steps, evidence-based? I will split this into system-level actions, what hospitals, health ministries, and senior clinicians must do, and personal peer-level actions, what you as an individual doctor can practice today. So let's start from the system level or organizational actions, and these are the highest priority. These are intervention. WHO and national plans in many countries prioritize, and they work best when actually implemented. What are these? Redesign work. Redesign work to reduce excessive hours and ensure protected rest. And this is called roster hygiene matters. Then comes the build safe, confidential access to mental health care for staff. Counseling that does not threaten licensing or career. Here, the confidentiality is key. Then comes the structured peer support and debriefs after critical incidents. Schwartz rounds, critical incident stress debriefs. These lower isolation and moral injury. The fourth is the reduce admin load. And for this, hire scribes, use validated documentation tools, and pilot safe AI-based transcription where feasible with oversight. Fifth step is that of gender-sensitive policies, flexible scheduling, parental leave, harassment-free workplace. The sixth, last but not the least, is measure and report clinician well-being as a safety metric. What gets measured gets fixed. So these are the 6 main steps which must be taken and implemented at the system level or organization level, to ensure that the staff does not suffer from mental burnout, and if they start suffering from, they are addressed in time and early. What are the individual and peer level things you can start today? These include 3-minute rest. After a difficult case, take 3 minutes, breathe, hydrate, step outside, and name one thing that went right. Short rests protect cognition, and this is very, very important step. Then is the peer checking. Make a habit. How are you? Really? In the morning, hand over, normalize, honest one line answers. Third is create a personal micro boundary. This is very, very important. A simple end of day ritual that marks work done, 15 minutes of family time, prayer, and walk, something like that. Then lean to ask for help. You should learn to ask for help. Use the words, I'm not coping well. Can we talk? Put it on your professional to-do list to seek support. So you should learn to ask for help. This is very, very important. Fifth is safety net planning. Know where to call. Local confidential counseling, employee assistance, trusted colleague. Keep numbers in your phone. So you must share your thoughts with your colleague, the one whom you trust, and you should take advice. Few quick scripts for leaders. If you are a leader in some organization, your ward, your department, what to say when you see a doctor struggling. So it's your responsibility as well. For example, if you see someone struggling, you can say, I have noticed you have been quieter lately. I'm concerned. Can we sit for 5 minutes? This is one query or one script or one sentence which can help your subordinates. Another example, you can say, you don't have to fix this alone. We have confidential support. I will help you connect. So this is another way you can help a doctor who is struggling with mental burnout. And then thank you for sharing. What small change could make work safer for you this way? So these and some other word scripts for our doctors are very, very essential, and they must be mastered in to take the confidence of their subordinates, come to their level, discuss with them what is problem with them, and to solve those problems jointly with the doctor who is struggling. Okay, what about the real world example of successful intervention? This is a Journal of Human Resource and Leadership. This is a reference from an issue which was published this year. Effect of mental health support program on employee retention in the healthcare sector in Pakistan. This article has been published by Hamza Saeed, University of the Punjab. And the purpose of this study was to analyze effect of mental health support programs on employee retention in the healthcare sector in Pakistan. So the Hamza Saeed, with this purpose, conducted this study, and what the findings are that the mental health support programs in Pakistan's healthcare sector have been shown to reduce employee turnover by improving well-being, job satisfaction, and loyalty. These programs also lower burnout and absenteeism, supporting workforce stability in a high stress environment. So, this is a real world example where successful intervention in coping with the mental burnout really leads to the positive impact. So, the final takeaways, the first is recognize early, watch for sustained changes. Second is talk early. One honest sentence can change a path. System matters, no doubt. Advocate for roster reform and confidential care. Uh, Protect your colleagues. Debrief after bad outcomes. Don't leave trauma unspoken. And invest in prevention. Your hospital's mental health plan is as vital as its fire alarm. You can take a screenshot of this, and these are the main five steps or five components which can really help the burnout of yours. These are the different resources and references I used in my this presentation. Dear colleagues, if you are a leader, your job includes protecting the hearts and minds of your team. If you are a colleague, your simple question, "Are you okay?" might be the lifeline someone needs. And if you are a doctor feeling alone, you are not weak and you are not alone. Just speak. Thank you. Colleagues, we cannot keep pouring from an empty cup. If we continue to ignore the mental health of doctors, we risk losing not only our own lives, but also the compassion and excellence our patients depend on. Let's break the stigma. Let's normalize conversations about stress, burnout, depression, and anxiety among physicians. And most importantly, let's remind ourselves and each other that seeking help is not failure. It is wisdom, it is courage, and it is the only way forward. Together, we can build a medical community where doctors are not just providers of care, but also receivers of compassion. Because a healthier doctor means a healthier society. Thank you for listening and watching. And thank you for choosing to care, not just for your patients, but also for yourselves. Take care. Khuda Hafiz.